Preventable is a 3-year Horizon Europe project. It is funded by the European Health and Digital Executive Agency. It will merge specialized clinical knowledge on rare tumor risk syndromes, pathways of care, real-life clinical data from patients and professionals with health economics models and social sciences approaches. The Preventable project will evaluate the clinical, social and financial impacts of implementing multidisciplinary and specialized care to prevent advanced disease in families that are affected with rare tumor risk syndromes. Preventable is a multidisciplinary consortium with professionals from the most varied fields. It is constituted by 9 full partners, 5 affiliated entities and 1 associated partner spread throughout 8 European countries. And RTRS in Porto is the coordinator of this project. So RTRS stands for Rare Tumour Risk Syndromes, which is defined as a group of rare diseases that are genetically determined from birth and that affect approximately 5 in 10,000 people or less worldwide. So patients suffering from RTRS, they have a high risk of developing several cancers across their lives and of transmitting this genetic risk to their descendants. We have 8 different RTRSs in the Preventable project: the Birt-Hogg-Dubé syndrome, the familial malignant melanoma, the gastrointestinal stromal tumors, the hereditary diffuse gastric cancer syndrome, the Li-Fraumeni syndrome, Poitiers syndrome, P10 hamartoma tumor syndrome, and hereditary leiomyomatosis and renal cell cancer. Preventable is important for the rare diseases community as a whole, as it provides valuable knowledge to enhance and optimize costs for targeted healthcare management. It provides new approaches and tools to estimate the real health cost for prevention versus treatment of rare diseases. It supports the healthcare decision and policymakers, but it also improves the clinical outcomes of patients and their high-risk relatives, promoting prevention over treatment. We expect that it promotes equal healthcare opportunities regardless of gender, social status and ethnicity, and provide guidelines for bidirectional communication between clinical teams and patients. It will promote community-based and people-centered healthcare structures. Intensive surveillance and the risk reduction strategies are the best way to safeguard asymptomatic RTRS patients from developing diseases, while minimizing healthcare burden associated with treatment of patients with clinically expressed cancers. This, in fact, has an impact on their families and the patients themselves. So, in summary, Preventable is the first project that uses multidisciplinary knowledge and real data to obtain the costs of optimized care and prevent several diseases to occur in a single individual and their families, and also to design better ways of communicating about prevention and with and between patients and clinicians.